Hello and welcome to Dr. Varsha Gaikwad's online teaching and learning. Today I am going to teach you a topic of diagnosis of pregnancy because it is very important that you diagnose pregnancy correctly and treat it accordingly. Okay, so we all know that the whole pregnancy is divided in 9 months, that is 40 weeks, and these 40 weeks are further divided in 3 trimesters: first trimester, second trimester and third trimester. This first trimester is from first week of pregnancy till 12th week of pregnancy. Second trimester is from 13th week of pregnancy till 28th week of pregnancy, and the last, that means the third trimester pregnancy, is from 29th week of pregnancy till 40th week of pregnancy. Okay, all of you understood what are the 3 trimesters and their composition in terms of weeks. So we need to diagnose pregnancy in first trimester of pregnancy, second trimester of pregnancy and third trimester of pregnancy. Okay, but the diagnosis part or the methods by which you are going to diagnose will be mostly in the first trimester. So let us learn first trimester in detail. Now, as I have already stated, the first trimester of pregnancy is from first week of pregnancy till 12th week of pregnancy. So what are the signs and symptoms that you are going to observe in first trimester of pregnancy? It is a set of symptoms and signs. Symptom means the complaints with which the patient will come to you, and sign is something when you examine that patient, at that time you are going to notice the things. So let us look at the collection of symptoms. So the first symptom to occur in pregnancy is amenorrhea. What is amenorrhea? Amenorrhea is absence of menses. Now, why there is absence of menses in pregnancy? Because there is no decline in the level of estrogen and progesterone. What is the physiology of menstruation? The physiology of menstruation is that whenever there is a decline in the level of estrogen and progesterone. Why this decline occurs? Because at ovulation, what is released? A female oocyte is released. Okay, and if the fertilization does not take place in that particular cycle, then what happens? There takes place a degeneration of corpus luteum. What was the function of corpus luteum? This corpus luteum was secreting progesterone. So if at all pregnancy will occur, then this progesterone will support the newly formed pregnancy till the development of placenta takes place. Okay, so the primary function of corpus luteum is to secrete progesterone till the formation of placenta is complete. Once the formation of placenta is complete, the secretion of progesterone will be done by placenta. Okay, so the corpus luteum was secreting progesterone, but in the absence of fertilization or in the absence of pregnancy, what is going to happen? This corpus luteum is going to degenerate. What do you mean by degenerate? It is going to die. Now, once the corpus luteum has died, there will be decrease in the level of progesterone, and this decrease in the level of progesterone will give a positive feedback on pituitary to bring about the menses. This is how the physiology of menstruation works. But what happens in pregnancy? This physiology itself is broken. How it is broken? See, what happens, as I told you, in the absence of fertilization. What takes place in pregnancy? In pregnancy, there takes place a fertilization of female and male oocyte. So what is going to happen? There is going to be a formation of zygote. So if there is a fertilization, there is no further decline in the level of progesterone. Why? Because the corpus luteum will keep on secreting the progesterone. Once the embryonic villi are developed, they will secrete the progesterone hormone, that progesterone like hormone, that is HCG. So the function of both HCG and progesterone is nothing but the support of pregnancy. Okay, so because there is no decline in estrogen and progesterone, there occurs amenorrhea in pregnancy. I hope the reason behind amenorrhea in pregnancy is very much clear now. Coming to next symptom with which approximately 60 to 80% of patient complains of, that is morning sickness. Why there is morning sickness in pregnancy? Again the hormone responsible for morning sickness is progesterone. How progesterone causes morning sickness? See, in pregnancy we need relaxation of uterus. How this relaxation of uterus is brought about? It is brought about by progesterone. What is the function of progesterone? The function of progesterone is selective, not selective. The function of progesterone is smooth muscle relaxation. But this smooth muscle relaxation has not got selective actions. That, what do you mean by selective action? That means it will not relax only the smooth muscles of the uterus. It will relax all the smooth muscles of the body, and that's why there is constipation in pregnancy. Okay, so coming to how this smooth muscle relaxation leads to nausea and vomiting. See, and this, why we call it morning sickness? Why we call it morning sickness? Because it is more pronounced in the morning hours. Okay, why it is more pronounced in the morning hours? See, throughout the night, like say for 8 to 10 hours, patient is sleeping. That means the patient is NBM. She is not taking anything orally. So what will be there in the stomach? There will be pent up gastric acid secretion. What do you mean by pent up? Pent up means jama hue. Because there is 8 to 10 hours of fasting. So this gastric acid or this HCl, what is going to do? It is going to irritate the gastric mucosa. And what progesterone has done? The progesterone has brought about the smooth muscle relaxation of the body. That means the cardiac sphincter, which is closed like this otherwise. See, cardiac sphincter is at junction of esophagus and stomach. During pregnancy, what happens? Because of the action of progesterone, this cardiac sphincter is usually closed, but because of progesterone effect of relaxation of smooth muscle, it is open in pregnancy like this. So what is going to happen? This HCl is corroding the gastric mucosa. It is irritating the gastric mucosa, and your cardiac sphincter is open. So what is going to happen? A patient will have an urge to throw up, and because the sphincter is open, she will end up throwing up. That means she will end up doing vomiting. This is the reason behind nausea or vomiting in pregnancy and why it is more pronounced in the morning hours. Next symptom to occur is frequency of micturition. Why there is frequency of micturition? Because in pregnancy, what lies anterior to the uterus? Not in pregnancy, otherwise also, what is the anterior relation of the uterus? Consider this as uterus and consider this as a bladder. Okay, so what lies anterior to uterus is bladder. In pregnancy, the volume of the uterus is going to increase because it is carrying a baby inside. So what is happened? What is the normal position of uterus? It is AVAF. That means what? Anteverted anteflex. That means what? The uterus is like a snake of a hood. It is like this. It is resting on the bladder like this. But in normal position, as there is nothing inside the uterus, it does not cause the mechanical pressure on the bladder. But what happens in pregnancy? Because this uterus is carrying a baby now, it will create a mechanical pressure on the bladder. What will happen because of this mechanical pressure? Because of this mechanical pressure, patient will have an urge to pass urine frequently. This is one reason. Another reason is that because of pregnancy, there is change in maternal osmoregulation. Because of this change in maternal osmoregulation, the patient will have increased desire of thirst. She will feel thirsty again and again. And if she is feeling thirsty again and again, she will end up consuming water again and again, and as a result of that, she is again going to have the urge to pass the urine. So this is regarding symptoms of first trimester of pregnancy. In my next video, I'll come up with signs of first trimester of pregnancy. You stay tuned.